everyone. Welcome to week 5. I'm so happy to say that we have finally made it to the halfway point of this quarter. Crazy to think it came up this fast. So this week, you guys are focusing on chapters 36 and chapter 11. Now for the day 1 video today, I'm going to actually focus on chapter 36. So chapter 36 is going to focus on assisting with physical exams. This is one of the key responsibilities that we will have as medical assistants. So what is your role during that exam? Well, some of your main roles during that exam are going to be preparing the patient exam room, interviewing the patient, documenting all of the information in the medical record, positioning and draping that patient, assisting the physician with and during the physical exam, cleaning the room after the visit, and instrument care. So a couple of these we've already touched on. For example, we know how to clean up the room after the visit. We know how to take care of the instruments. We know how to document everything in a medical record. We've been looking at those before. So let's take a look at some of the other ones. So how do you prepare the room for the exam? So one of the things is as you're cleaning up the room, you're really preparing it for the next patient. So as medical assistants, you're going to be really required to dispose of any used patient gowns or drapes. If they are soiled, they need to go into a biohazard waste bag. You're going to clean the exam table with the proper disinfectant. And once it's been allowed to air dry, you're going to place on new table paper. You're going to dispose of the equipment used during the previous exam, if it was a one-time use only. If it is a reusable, you're going to make sure that you clean, disinfect, and sanitize and sterilize that equipment for the next time it will be used. You're going to make sure that all surfaces of the exam room have been disinfected with the appropriate cleaner. So either that 1 to 10 bleach solution or those Cavi wipes that we've talked about. You're going to make sure that all the lids on biohazardous containers are closed, and if they are full, you need to remove them and replace them. And then you would set up for the next exam and get the equipment that you would need for that exam. Next would be interviewing a patient. Now, we haven't really been doing a whole lot of interviewing. You've been taking vital signs, but you haven't been asking any of those interview questions. So what I mean by an interview with a patient is really getting the patient's health history. That history is really broken down into 6 categories. The chief complaint, or the reason for the patient's visit that day. 2, the present illness, or really this is going to be a very detailed, descriptive piece of what the symptoms are. So you're going to look at what was the onset, what's the duration, how long has this been going on, and you're going to ask about the intensity of each symptom, and each symptom will need to be documented with each of those pieces. Then you also have your past medical history, so that's area number 6. That's going to be the part of the history that includes all diseases and medical problems that the patient has experienced in the past, including, but not limited to, prior surgeries, injuries, diagnosis, disease, treatments, all of that. Then we'll move on to number 4, which is your family history. And that's really a record of the health problems of your blood relatives. Now, blood relatives include those that you're related to by birth. So, mom, dad, brothers, sisters, grandma, grandpa, aunts, and uncles. Okay, if you're not related to them by blood or by birth, you don't really need to know much about their family history. Maybe it's an aunt who married in, or an uncle who married in. Number 5 is the social history. So this is going to deal with lifestyle patterns that could affect the patient's health. For example, smoking, drinking, using recreational drugs, the occupation, marital status, sexual preference, their diet and exercise habits, and their sleep habits. All of those fall under the social history category. And finally, the sixth piece and the sixth area of an interview is the review of systems. Now, this review of systems is generally completed by the physician, and they use different methods and tools in order to inspect and examine the patient's body. There are 6 methods that physicians will use during a review of systems. They may use, number 1 is inspection. So they're going to visually examine the outside surface area of the patient's body. They're going to use their eyes, no fun other tools. Number 2 is palpation. This is where the provider is actually going to use their hands to feel and touch not only the skin, but underlying organs that are accessible for them to reach. Number 3 is percussion. This is where they're going to take their fingertips and they're going to tap on the body, lightly but sharply, just so that they can gain some information about the position and the size of underlying organs. Number 4 is activation, and this is really a process of listening to the body sounds, and they generally use their stethoscopes to do so. Number 5 is mensuration, which is really where we use tools to help measure different body parts and body areas. And the last one, number 6, is called manipulation. And this is really the process of seeing what that range of motion is for a specific joint on the body. Now, part of your job during a physical exam is positioning the patient and draping them. So when we drape a patient, what we really want to do is we want to keep their dignity and their pride in mind, because we want to be able to keep them covered. Okay, that's the whole purpose of draping. You're going to keep them completely covered except for the area that is being examined. When you position a patient, it's really helping put them into a position that the provider can easily look at and examine certain body parts. There are 11 positions that you may be responsible for placing a patient in. And they are supine, dorsal recumbent, lithotomy, Fowlers, semi-Fowlers, prone, Sims, knee chest, Trendelenburg, prophylactic, and sitting. So your book does a very nice job of breaking those down and explaining them in a very easy way that you will be able to understand. And the final part to your job as a medical assistant is really assisting the physician with that physical. So what that means is you're going to be responsible for, again, draping and positioning the patient. If they are an elderly patient or maybe they're disabled, it may be your job to help keep that position with the patient during that exam. You're going to be responsible for handing instruments, equipment, and other medical supplies during the procedure to the physician. You're also going to be responsible for documenting and labeling any specimens that are taken from the patient, and also making sure that they get to the appropriate lab areas. You're going to offer reassurance and comfort to your patients, because I don't know how about any of you, but certain procedures that I have, I've been very nervous during, and that medical assistant is there to help keep me calm. So that's going to be your job, helping to keep your patients calm during procedures. You're also going to act as a witness for the behaviors of the physician and the patient. So one of the really important things to understand that is, if you are a medical assistant and you're female and you have a male provider, you will be responsible for attending and being a part of every female breast exam and every female pelvic exam, just because we don't want any sort of backlash to come from the male provider doing that by himself, because then it turns into a he said, she said situation, and we don't want that. And the last piece is you're going to carry out any treatment plans that the provider puts in place. That will include doing any patient education, applying any dressing, and administering any medications or immunizations, along with scheduling any diagnostic testing that the physician may order. It's really important that you understand that during a physical exam with a patient, you're really the doctor's second set of hands and eyes. And you're there to make sure that things go smoothly and that he has everything that he's going to need during that procedure. Alright guys, so that's really all I have for the day one video. Please, as always, read your chapter. It will help not only with what we're going to be doing in the lab, but also with your homework for this week in your lecture class. So please make sure you're taking advantage and reading the book. Any questions you have, please make sure you bring them to lab, and I will address everything that I can during the open lab time. Have a great week, guys. Bye-bye.